Hello, I'm Cindy with Wisconsin Voices for Recovery, and this is Speak Out on Stigma. Today we will be hearing from Betsy, Mental Health Supervisor at Greene County Human Services. Hi, Betsy, how are you today?
I'm good. Thanks for having me.
Great. So tell me, how does stigma against people perpetuate substance use disorder?
It's such a vicious cycle. I think it's good to kind of break it down into external and internal stigma. So people can kind of absorb stereotypes about what somebody who uses a substance looks like and just perceive judgment in the general community and social media, entertainment, and they can very easily feel like that about themselves. The judgment that they see towards others, they're gonna be more likely to assume people have towards them. I mean, think about the image that comes to mind probably when you think of the stereotype of somebody who uses a substance. And so a lot of people who do struggle with substances feel a lot of shame and regret and avoidance because they're kind of buying into that stereotype. And if somebody feels that badly about themselves, they're going to be less likely to openly talk about it. So, of course, this then gets in the way of asking for help. People don't want it on their medical records that they are struggling with a substance. They don't want their loved ones to know. They're worried about legal consequences, worried about parental rights, worried about their job. And they just try for a long time to fix it on their own by themselves. Um, and the thing is, if they were to be open about it, their fears are probably true because the stigma is out there. They are very likely to face legal consequences, have people question their skills as a parent. And so it perpetuates this pattern of people waiting for a long time to get help. When if we can kind of step in and surround them earlier in the stages of a substance use disorder developing, we're going to be more likely to turn the tide and hopefully get them back on track. People don't want that. People don't want to lose control of their lives. Nobody wakes up and decides I'm going to be an addict someday. That's not what goal people have in mind. And so if we can help them change that course earlier, uh, hopefully we can keep people alive. Yeah, stigma is a beast.
What can be done to address stigma in the community, systemically, and within the structures that people with substance use disorders encounter?
So I have a lot of thoughts on this piece because I've largely worked in the medical system and in the hospital setting in my career. Um, And certainly one thing that comes to mind is language. It's a very simple change to make. Um, I want to note that I used the term addict just a minute ago, and I was using that in emphasizing the judgment of the stereotype of the addict, which is very real when tested, when we use language like addict, people are more likely to have judgments about the person being referred to than if you say someone with a substance use disorder. And so language is just such a simple, simple way that we can begin to shift that. Um, and then also, you know, we as a medical system, I think, need to really push for it to just be standard practice to ask about and treat substance use disorders. I just literally, I chose this question about a week ago to reflect on, and literally since then, I just was talking to a behavioral health prescriber who told me that they don't work with people who use substances because they suck the life out of them. Um, I've rarely heard a colleague refer to working with substance use disorders in such strong language. Um, but I know that those thoughts are out there. Um, I'm glad people are getting a little more careful about what they say. That's a good first step, but um, we really need to change those thinkings. So to some extent, that's about training. A lot of medical professionals have those thoughts, like they have the fear of working with somebody who's drug seeking, or that if they are willing to prescribe medications for addiction treatment, that they're just going to have a whole caseload of addicts, and that would be bad. Um, when in reality, when you talk to medical professionals who used to have those perspectives, and then they open their minds and began to try to work with people who are looking for help with substance use disorders, what we've kind of realized is that the assumption is that they're going to be working with somebody who's going to be in a tug of war and just trying to get more meds out of them. When in reality, a lot of people looking for help, they're not at that stage. They are looking for change, and they just need help accessing life-saving medications that are anybody can prescribe. Anyone with a DEA license can prescribe. Um, and so those providers that kind of made that shift have, I've heard it time and time again that it just was such a rewarding thing, because instead of being in that tug of war, they're able to actually treat the condition, instead of just fighting over the symptoms of the condition. And so I really hope we can get more providers kind of coming out and saying that, that they have really been glad that they made that change. And I also really believe that, you know, hospitals tell their providers to do a lot of things. They give them a lot of direction, and there are a lot of requirements. What if it were a requirement that any primary care provider be willing to prescribe medication for addiction treatment? Why is it optional for them to choose to not do that? To just say that that's not something they work with, when it's something that's all over in our communities and so treatable, especially with medications. So yeah, those are thoughts that I have a lot. I also think about the fact that it's criminal to use a substance, many substances, um, that just creates such complications for people to get back on their feet. It doesn't the fear of punishment doesn't stop them from using, it just stops them from asking for help. Uh, and and then it causes a lot more barriers if they do make changes down the road. If they have a criminal record, that really causes issues with getting jobs and housing. So I have a fantasy that maybe someday substances will be decriminalized.
Yeah, thank you for sharing those thoughts. Very important questions that you're raising. And the image that came to mind the last comment that you made was, kind of creating a cycle of barriers almost.
Mhm.
And that's, just exponentializes the challenges for people seeking help.
Absolutely. Hmm.
Is there anything else you'd like to add?
I guess just to say I really love that you guys are doing this project. I've really long admired the sort of coming out and the pride in the LGBT community, and thought, gosh, I we really need this in the substance use community. And I know there's been a lot of efforts in that direction overall, and it's just cool when I see them happening, that there's a lot to be proud of. If you survive or are surviving a substance use issue, like, you should be damn proud that you're here, and I'm glad you are.
Absolutely. Thank you so much, Betsy, for sharing your views on stigma. And thank you to our viewers for watching. Speak Out on Stigma is a forum to raise awareness about the harmful impact of stigma on those in and seeking recovery. Recovery is for everyone. Together we can eliminate stigma. Don't forget to like, comment, and share this video. Thank you and have a good day.